is Rebekah. I'm talking about my tubal ligation today that I had at the Cohen Medical Practice, specifically with Dr. Erb. So I've known since I was pretty young, like early 20s, that I just didn't want kids. That's something that I had pursued for a while, going to different doctors, asking about my options, and for the longest time, it wasn't really an option. I was met with a lot of condescension and people telling me that, I might change my mind. And so I had given it up. Then Roe was overturned, and so I started more seriously looking again, and I found Dr. Erb. Pretty clearly, I was really struck by how comfortable she made me. She didn't speak down to me. She understood that I didn't want kids, and she respected that. And she still explained the process to me in terms of, there's going to be some interviews, because obviously it still is like a big decision to make for anyone's health. And so they're not just going to do it, without talking to you and making sure that you understand all the repercussions and what's involved, and because it is a permanent decision. And so she went through all of that with me, and I just felt really respected and taken care of. It was great. They outlined at every step, like even before the day of, they told me, of course they did, but they told me what to expect in terms of what that day was going to be like, how long it would take, how I would need to plan, both in terms of structuring the day, for what the surgery would be like, and how I would need to do my pickup for getting home, all those things. And then the day of, I spoke with several different people who were just checking in, making sure that my comfort level was okay, that I still wanted to do this. Just walked me through what each step was going to be like, including what the general anesthesia was going to be like, because I've never had that before. It's really easy. I'm sure that there's some variation just because everyone's body is a little bit different, but honestly, I had never had any kind of surgery before. I was pretty nervous about that, specifically the anesthesiology, because it's just, if you haven't had it before, you don't know what to expect. But the last thing I remember was they do a countdown. I can't remember if it was from 10 or something similar to that, and then you're just gone. And then you wake up, and I woke up in relative comfort, a little groggy, obviously, but it was just incredibly easy. Yeah, pain level, I would call it more of a discomfort level rather than like actual pain, because I think of pain as being sort of like sharper than what this experience was like. And obviously you've just had surgery, and so there's going to be some discomfort for a little bit, but I had the surgery on a Friday, and I had the weekend to recover and just sort of take it easy. And then I think most people can sort of go back to work on Monday, is what they told. I was working from home at the time, which also was a little bit nice. Like if your employer does let you take a little bit more time, that doesn't hurt. And of course, they give you some medication so that, for the immediate couple of days, so that you're staying in a discomfort place rather than a pain place. So I would say that the pain was pretty minimal. It was more of just like, for a few days, wearing pants wasn't the most comfortable because one of the incision points is like around your belly button. I feel great about it. It's one of the best things I've ever done for my personal health. I wish I could have done it sooner. I wish it wasn't as, it wasn't gatekept like it was, but maybe that's changed more, as time goes by. But I'm very happy about it. I have no regrets. A ton, especially because of Roe being overturned. I've always been good about being consistent with my birth control, but the fact of the matter is that birth control isn't 100% effective. Like, mistakes can happen. And so, especially because I've been pursuing permanent birth control for such a long time, it was really a peace of mind. Like, I think one of the things I expressed to Dr. Erb shortly after was that, I thanked her for, basically letting me be, the person who I always knew I am. straightforward. I don't want to keep saying not condescending because that sounds like sort of the bare minimum. So like maybe a different reframe of that is she's warm, she's personable, she understands, and I just felt really taken care of with her. It was great. I mean, it was a little bit ago since I did have the procedure, so I don't remember like the office staff as vividly, but I mean, I'm sure if something, I would have remembered if there was an issue, right? So it was fine. It was lovely. I would say she's going to listen to you. She's going to answer all the questions that you have comprehensively, address any concerns you have, and like you'll be very well taken care of. Just that the surgery isn't something to be afraid of. I know that that was kind of previously covered in an earlier question, but for me, that was the biggest piece of just being like a little bit unsure, or a little bit nervous. But in terms of surgery, it's so incredibly easy. It's more and more common that women don't want kids or want the procedure because they've had kids and they're just finished having kids. And I feel like that stigma is really going away. And also there's a lot of us who feel this way, and there's communities online where you can like connect and share stories and feel heard if you're someone who's living in an area where maybe it's less common. But I guess it's New York and Dr. Herb, so like it doesn't super apply, but